Hi, I'm Abby, the Clinical Nurse Advisor. Let's look at high flow oxygen therapy and CPAP therapy. High flow oxygen therapy is typically used for spontaneous breathing patients who require oxygen at higher flow rates. This therapy can effectively be used to treat patients with a hypoxemic respiratory failure, and it's usually administered via a nasal cannula, which can provide warm and humidified gases up to 80 litres per minute and an FiO2 between 21 to 100%. High flow oxygen therapy can help improve mucociliary clearance, reduce your respiratory demand, improve oxygenation and increase your alveolar ventilation due to that reduction in anatomical dead space. Continuous Positive Airway Pressure, otherwise known as CPAP, delivers a fixed level of positive pressure when the patient is breathing in and out. It doesn't act as a ventilator, but helps splint the airways open to support a natural respiratory pattern. It does this by recruiting the collapsed alveoli in the lungs and increase that surface area for gas exchange, which in turn makes breathing easier for the patient and improves their oxygenation. The AquaVENT transition system in the AquaVENT FD140i facilitates this delivery of CPAP and high flow therapy for single patient use over a period of 7 days. This seamless transition in between therapies offers a convenience in escalating or de-escalating patient treatment. For example, transitioning from CPAP to high flow for weaning or for breaks or for meal times, all through one machine in one system. This process minimises waste and reduces disruptions to therapy, ultimately saving valuable time for your healthcare providers and improving patient outcomes. The addition of the heated and humidified gases enhances your patient comfort and aids in clearing secretions, which can potentially improve therapy tolerance. Optimise patient care with one system, delivering 2 therapies for greater efficiencies.